Hi, this is Cheryl with Cornerstone Hospice again. Wanted to talk just a little bit about advance directives. Advance directives is a document that's used when someone is in a situation where they cannot make medical decisions for themselves. They may have been in a car accident or had a stroke, and now they're in the hospital and family members are wondering what that individual would want for life support. They're being asked questions about respirators, tube feedings, CPR, blood transfusions, and the patient's not able to answer those questions. So there is a document that we support called 5 Wishes, and it is an advance directive that was developed by a gentleman who consulted with Mother Teresa to talk about who that person is going to be to make those medical decisions and what kind of answers the patient has given that surrogate in advance. So this document is written in real people words. So it's a legal document in many states. There are 42 states that it's actually legal. Florida is one of those. And there's a list in here on page 3 that gives you that list. So wish 1 is the person I want to make healthcare decisions for me when I can't make them for myself. You have an opportunity to name 3 people, and it's important that you have the conversation with that individual in advance to make sure that it's okay to put them on the list. Some people don't want to have that kind of responsibility, but with the guidance that is given in the book, they may feel more comfortable doing so. You want to pick somebody who is willing to play that role. It may not be your spouse. They may be too emotionally close to the situation. It might be that best friend or family member. And you name 3 people because the first person might not be available. So you have person 1, person 2, and person number 3. And their contact information is in there. It also describes some of the things that that individual would be responsible for, that they would be able to see your medical records, approve decisions. They might move you to another state where other family members might reside. They might donate your organs to others. They would be able to apply for Medicare or Medicaid on your behalf. So in this document, this is a working document so that you can cross out things that you don't want them to do, and there's opportunities to write in things that you do want them to be able to have that might not already be listed. Wish 2 is for the kind of medical treatment I want or don't want. And there's a description in here for what life support treatment means to me. And it means any medical procedure, device, or medication to keep me alive. Life support treatment includes medical devices put in me to help me breathe, food and water supplied by medical device, which would be tube feeding, cardiopulmonary resuscitation, CPR, major surgery, blood transfusions, dialysis, antibiotics, and anything else meant to keep me alive. Sometimes people have spiritual reasons for not including some of these, and so this is an opportunity for the individual to put those restrictions in writing so that everyone, the medical professionals and the surrogate, know what is considered appropriate. This document then has several situations under which that might apply. So they might be close to death. They might have permanent and severe brain damage and not expected to recover. They might be in a coma and not expected to wake up or recover, or in another condition under which I do not wish to be kept alive. And then there's little check boxes. I want to have life support treatment. I do not want life support treatment. If it's been started, I want it stopped. Or I want to have life support treatment if my doctor believes it could help, but I want my doctor to stop giving me life support treatment if it's not helping my health condition or symptoms. The patient also has the opportunity to write other things in here. Again, this is their document, and they can be as specific as they'd like to be. This document we call, the 5 Wishes, we call the Advance Directive with a Heart, because it goes beyond just the medical treatment that an individual might need, but also that individual, because as hospice we really believe that it's a holistic approach to that person's care. And so some things that other people might not consider. So wish 3 is my wish for how comfortable I want to be. Something like, I wish to be massaged with warm oils as often as I can be. Or maybe I wish to have a cool, moist cloth on my head, or my lips and mouth kept moist to stop dryness. I wish to be bathed often, or make sure that my hair is combed or my nails are trimmed and that I look nice when someone walks into the room. I want to know about options for hospice care to provide medical support to my family and to me. I wish to have religious readings read, or someone coming and visiting me from my spiritual community. Wish 4 is how I want people to treat me. I wish to be cared for with kindness and cheerfulness and not sadness. I wish to have my hand held and to be prayed for. I want somebody to come and read stories to me or play certain music. Hearing is the sense that we retain the longest, and so if someone's going to be having negative thoughts or conversations, perhaps they need to step into the outside hallway rather than being in my room while I'm there. If I'm not able to control my bowel or bladder functions, I wish for my clothes to be clean all the time. Little things that make that person feel like they still have dignity and control in that situation. Wish 5 is my wish for what I want my loved ones to know. I wish my family and friends to know that I love them. You know, sometimes an automobile accident happens and maybe somebody had an argument that morning and they didn't get a chance to really say I love you or to make up. I wish to be forgiven for the times I hurt my family. I wish for my family and friends to know that I do not fear death itself, and I think that it's not the end but a new beginning for me. There's several things on here that people can check off or circle or put flowers next to or highlight in some way. Maybe a list of people to call that you would want to know that you were in a situation in the hospital that you might like them to visit. If anyone asks how I want to be remembered, please say the following about me. You can kind of write your own things that you always wanted people to remember you for. Maybe you smiled at people that you didn't know, or picked trash up off the street, or little things that made you a special person. And then you sign this document. In certain states you have different requirements. In some states you just need a couple of witnesses. In some states you actually need it to be notarized. And then you complete this, you give copies to the people that you've named as surrogates. You give copies to other family members so that they know what those surrogates require, what their responsibilities are. Give a copy to your doctor, to your pharmacist. Most importantly, this document can be used to start the conversation with your family. So many times our kids will talk to us about sex and drugs, but they don't want to talk to us about end of life. But this is the most wonderful gift that you can give your family, because when you're in a stressful situation and they don't know what to do, then there's arguments, there's disagreements, there's differences of opinion, and sometimes those differences can destroy a family. There are families that have not talked to each other because they disagreed with mom's care or dad's care or a family member's care. So you really need to have the conversation. So use this document as a launching point for that. I filled it out. I want to tell you what's in it. And even though you might disagree with it, I ask that you follow my wishes. I hope that this document helps you a lot. And it's available through a lot of hospices. There are other places that you can access this, and it's actually available online through Aging with Dignity. So thank you for joining us today.